So for the basic function of the heart, as they usually say, it's the size of a fist, probably fits pretty well. And the blue side denotes the deoxygenated blood that is coming from the body, coming back to the heart. So you have from the superior vena cava coming from the upper part of the body, your upper limbs, your head, coming down your inferior vena cava from the rest of the body, comes down to your right atrium. Then your right atrium collecting chamber, if I can call it that way, goes down through your valve to your right ventricle, right at the bottom, what you're seeing here. And that pumps through your pulmonary artery to your lungs, both your left and your right lung. Clean out your blood, remove your carbon dioxide, oxygenate it well, and then it comes back to your left atrium. The left-sided collecting chamber goes through your valve on that side called your mitral valve. Then you have your left ventricle, the muscular beat that you're always taught in school, that pumps blood through your main vessel called the aorta to the rest of the body, going up to the head, the upper limbs, and then down to supply the lower half of the body.
Imuche kesich lakwet netinye kaimutikab muguleldo anan kosich chi kaimutichuton yon kakoet kosubkei ak atebwekyik.
So when you say cardiac, you mean anything that pertains to the heart in general. So it could either be structural, involving the different layers of the heart. So you have one that's a layer that covers the heart called the pericardium. You have the muscle of the heart itself called the myocardium. Then you have the inner lining of your heart, which is usually called endocardium. The diseases that affect the heart could simply be classified into two main groups. Could either be what you say congenital or acquired. Congenital could be something that essentially you're born with. It's something that you record. There's no known cause for it, though there are certain syndromes that are associated with it, like Down's syndrome and some diseases in pregnancy, or tobacco smoking in pregnancy is known to cause some of those congenital diseases. For the acquired, then they affect the different either parts of the heart, either the vessels or the structure of the heart itself. For most of the congenital heart diseases, they may be asymptomatic in terms of your child may actually grow well if the problem is not so big to actually cause symptoms in the child. But for those that become symptomatic, you may notice your child using a lot of energy when breastfeeding, so they'd be sweating a lot, or they may have bluing of the lips, bluing of the fingers. They don't grow as fast. They have growth stunting and failure to thrive. Those are some of the most common symptoms you'd see a child with congenital heart disease present with. For treatment of the congenital heart diseases, it depends on the cause of the congenital heart disease. If it's some of them, if for those that you've had people say has a hole in the heart, some may actually close spontaneously on their own. But for those that progress on and the child becomes symptomatic and will require treatment, they may actually require open heart to rectify some of the defects that they may have in the structure of the heart.
Yon kakeyochi lakwet yatitaetab muguleldo, konyolu kekochi kerichek en kila betut.
For most of the children, once they've had their treatment done in terms of if it's either medical management or surgical management, for the medical management, and that would require subsequent clinic follow-up, because every time as the child grows or as the child develops, then their physiology changes and you'll have to adjust their medications depending on whichever season they come in the low season when they're feeling unwell or when they're doing better. For those that have had surgery, they're clinically more improved. Most of them resume to their daily activities. They play like any other child. They basically end up living quote unquote a normal life. They would definitely require subsequent post-operative clinic follow-up, which will be in their closest facility where they actually have resources to a cardiac department. But thereafter, they are happy children. For the so-called holes in the heart, some of them are spontaneous. You never know what might have precipitated them. Some are associated with the syndromes, like Down syndrome is associated with some of those defects or holes in the heart. Others may be caused by, as I had mentioned, tobacco smoking in pregnancy is one of the causes for some of the congenital heart diseases that children may present with. It is highly advisable for every Kenyan person to get an insurance cover. We have the national scheme, we have the private insurance firms, and that will help you in terms of catering for the cost for the treatment of the heart problem, because truth be told, it is quite a costly procedure, and that will help each and every Kenyan afford the treatment that they deserve.
Gladys Chemtai ko kametab lakwet nekikisich kotinye kaimutikab muguleldo. Mwoe inendet kole kisich toretet kobun sipitalitab Tenwek kosubkei ak kenyisiek chechang chekikosich lakwenyin kaimutik chechang.
En kainenyu ko Gladys Chemtai, abunu komostab Londiani, Ceres. Lakwet kekuren Joy Cheptoo. Kinam lakwani kianae kokikanam kotam kosumbuane kolololi. Akakase konome metit ng'weny en atkai kora. Kibur amuti sipitali konam ketriteni kelen monitoring kibore kecheken ko kitindo heartbeat nenyin ko kimi barak. Kereferan awo Dr. Lois Kericho. Kepimanen yoto kenyor ko tindo konda. Kereferan to Mata Hospital. Lakini due to ng'alek chekibo election komamuch awo Mata Hospital. Anyon ireu en Tenwek. So kikimi Tenwek en mwezi wa pili kenyiniton. Ko kikang'et ko kibi problem ak ane kanyor nekibo kelek komataketoret en kasarab. Ketoret korong kechopchi kelek akonam lain akereferanech ngebwanen arawechuto kora ko kongeitu ko konyor toretet en kikitumande nekitoret on Tuesday. Ako nguni ko akere komie. PDA ko kitindo konda en muguleldo ko kiyai keng'et kechopchi kesiban kong'ato amu kitam kong'ete kong'olegei ngoba korotik kobendi nini kong'olegei chebo oxygen ak chematindoi yani oxygenated and deoxygenated blood ko kiyoche komixen. Ko ngunon ko kokisileni asikobit kwa age tugul komosta kwa lain koma ai konam lainot kwa shangaa ngoek only 3 days so kwalil mara takobek arawet ko kwa baibai iman kabisa amwaini Jehova kongoi. Shida nene ilikuwa akerte ko different, yani mi age nemako mara tindoi tigityo, mara komi age ne kilen mara pains na nini yani pulse alak mara maboisie, lakini ko chitugul netindoi shida netindoi mara tindoi lakwet shida noton maleni sikorib kabisa komi konyoiset, makilen kele manyoru konyoiset, kitu konyoiset amat koim yani akerib lochoton akecha kikoin kora moyo sikoboiboikitun akichek. Amwae kongoi kabisa amun yani just imagine mi ot ngeten biik elelo kabisa kobwone ro. Amwae kongoi kabisa amun ripset nemi en ireyu ko ripset nebo maana kabisa, ripset nekiribe chito komi ot kou komosita nekimi kou nebo HD ko ikere kele yani nekilein ui akibokokyi lakwet daktari ako nenitu kokiribu lakwet komie ko kit nebo maana kabisa. Ng'aleni chitugul kora yani chi netindoi nemi shida kou noton tos ketembelionchi sipitali nebo Tenwek sikobit toretet.
Kamwa Dr. Violet kole mamiten kit neiboru kole yatitaetab muguleldo koweche sobetab chi. Kamu nyolu kotoreti yatitaet noton sobetab chi age tugul netinye kaimutik choton.
The heart surgery itself may or may not affect your lifespan and the quality of life that you live. I may not have statistical evidence to support what I'm saying currently, but from what I've seen, the two are almost the same. Whether you have your heart surgery, if it's had early enough and you're able to recuperate well, then you end up living an essentially long and healthy life.
Kamwa Dr. Violet kole en Bomet County kosiche biik chechang kaimutikab muguleldo yan kakoet kosir lagok chekisiche kotinye kaimutik choton.
In Bomet County, what we mostly get to see is the acquired form of the disease, which is mainly rheumatic heart disease caused by an infection that they have earlier on in their childhood. That's what we see most commonly here in our setting, the rheumatic heart disease, which is pretty common. So for the adult presentation of acquired heart diseases, their spectrum is wider because they've had longer years to be exposed to the infection, and therefore the changes they've acquired in their heart have actually slowly been progressing through the years. So for them, the acquired becomes more. You may have a 40-something-year-old individual still presenting with the same rheumatic heart disease, but for them, because of the concomitant hypertension and diabetes, which also cause heart disease on their own separately, you still have the coronary artery disease in adults. So for the adult presentation of acquired heart diseases, their spectrum keeps growing.
Kora, kumwoe inendet kole atebwekab chi koimuche koib kaimutikab muguleldo.
Lifestyle mainly affects, if I can call it, the two main diseases which would be hypertension and diabetes, because each of them have their own heart disease, if I can call it. You have hypertensive heart disease and you still have diabetic heart disease. Now together, then definitely it ends up being synergistic effect in terms of how it affects the heart. So lifestyle does play a key role when it comes to taking care of your heart. For the diabetic patients, first line of management for diabetes is lifestyle changes and dietary changes. So that's a very key role when it comes to long-term effect. It's not an immediate thing. That's just as the disease grows and manifests slowly, the changes when it comes to the heart also, trying to either keep the heart or improve its condition also occurs progressively. And also for hypertension, some of them are told low-salt diet and what they call the DASH diet also play a role when it comes to changing or affecting the general health of the patient. We use what you call the contractility of the heart to assess the progressive damage that the heart acquires over time. And that affects how the clinical state of your patient, if they're able to do exercises or their general activities on a day-to-day basis. So the contractility is basically what you talk about. You're told your ventricle is not contracting well, and that happens as the disease progresses. So initially what you would see is your chest x-ray is taken and you're told your heart is big, which is an adaptive measure that your heart takes to the damage that it's been progressively undergoing. And it modifies, or the structure of the heart keeps changing depending on the disease process that's ongoing. So you're told you have a big heart, and definitely the heart that's that small and the heart that's big will not be functioning the same. Definitely the contractility may be different. So that's what we mainly use to assess the function of the heart.
Ani muche inaita nogole negit isich heart attack.
The most common sign that you may be having a heart attack is usually chest pain. The classical sign would be chest pain that you're told either radiates to your jaw or to your shoulders, and it's usually a sharp pain. It may be start off on exertion, like when you're doing an activity, you have your chest pain, and then when that starts, you should go to your physician and explain that because those are first signs of what they call angina, the chest pain, that progressively would lead on to the classical heart attack, what is called the myocardial infarction. So the chest pain is one of the most classical signs that you may be having a heart attack. Some of them describe it as they are seated and all of a sudden they hear their heart is beating fast and strong, and that's one of the symptoms we call palpitations that a patient may present with when it comes to heart disease. Usually that happens even when you run and you stop, all of a sudden your heart is beating very fast. That is normal. But when you walk 50 meters and all of a sudden you start getting palpitations, and previously you would require to run a whole lap of 400 meters and you get palpitations, then that's something to watch for. When you're seated and all of a sudden you start getting the palpitations, that's something to report about. So if you know someone who has had a heart attack before, or you've seen someone who has had an attack before, the first thing you probably should do is get them to hospital immediately and as fast as you can. Emergent and urgent treatment for the heart attack is very crucial to make sure the effect on the heart is minimized and can be evaded as much as possible. The symptoms are usually seen way before the patient has the first incidence of what they'll present with a heart attack. They may have had the repeated episodes of the chest pain before, but no one takes note of it and you brush it off. It's just a chest pain. It came, it stopped, and that was it. You get shortness of breath when usually you'd walk 3 kilometers and get short of breath, but now you walk 1 kilometer, you walk 500 meters, you walk 200 meters and you get short of breath. Such symptoms are something that you should present to your physician way before way before you start having the severe chest pain that you would actually be diagnosed with as having a heart attack.
Akot kounoto, komwae Dr. Violet kole mi biik che maimuche ketoret ak yatitaetab muguleldo. Ak en biik cheu chuto ko kikochin kerichek.
Unfortunately, yes, there are patients whom we get to see, and unfortunately the heart has been burdened and has suffered long enough such that surgical intervention is not an option for them at that point in time. So what do? The way we channel them is through medical management, make sure that we improve their heart function as much as we can using the medications that we have. And we have what you call palliative care, which, yes, it may sound morbid, but it's actually making sure that every patient that you see is comfortable with whichever disease they have. It doesn't define which illness, it's every individual that is catered for is made sure that they're actually comfortable. So we can enroll them into palliative programs which are widespread throughout the country, available to even the nearest health facility that's closest to where they stay, and if they need analgesics or if they need an urgent refill of the medication, they can actually get it.
Kora, komi biik chekikochin mashinit netoreti muguleldo ne naat ko pacemaker.
There are certain illnesses that affect the electrical conductivity of the heart, and that's when a patient is deemed to need a pacemaker. For such incidents, for such occurrences, they actually get a small gadget that's fitted and helps to make sure that their heart beats at a rate that's regular and enough to actually support perfusion of the entire body, because once it becomes like the rate drops to a certain level, the blood pressure may drop and the patient may actually present with what they call syncope or fainting episodes, lightheadedness, dizziness and such like symptoms. So that pacemaker is fitted. It definitely requires, like any other machine, it will require subsequent follow-up, just like any other procedure that is done when it comes to heart disease. For our post-operative patients who have had open heart, most of them require what you call lifelong anticoagulation therapy. Now, depending on the agent that you use for anticoagulation, most of the time we use what you call warfarin, and that requires repeated monitoring. It has its implications when it comes to diet, what you can take and what you cannot take. So for such patients, we advise, especially for the greens, it will be leafy vegetables, it will be apples, green apples, it may be avocados. They require a constant amount throughout. If they can manage to do that, that would be the best thing instead of the fluctuations, because that alters the lab test that is used to monitor thereafter. So we just advise a constant amount of the greens in their diet constantly. But for the other agents, if they use aspirin, then they may not require such close monitoring, though they still will require follow-up.
Kamwa Dr. Violet kole en wikit agenge kotoreti Tenwek Hospital biik chesire 10 chetinye kaimutikab muguleldo.
For our particular facility here in Tenwek Hospital, I can gladly say over the last about 5 months, we have made it a regular practice to do about 4 to 6 cases every week of open heart surgery. So that will total to almost every month you have 25 to 30 patients who go home after their open heart is done, gladly for the last 6 months. The insurance actually helps when it comes to catering for the financial costs of these patients, and that would be the emphasis that I would lay across. If everyone can, yes, register for the NHIF. It's a national fund. Anyone and everyone is eligible to have it, from the child who's born today to the elderly grandmother at home. Everyone is eligible to have it. The private insurances are also there for those who can be able to access it, and that will help them access whatever form of healthcare they will require when it comes to their cardiac disease, regardless of the facility they go to.